When people talk about fertility treatment, they often talk about IVF, but that is not the only option. And Dr. Celso Silva, who works in partnership with Women's Care Florida, is back to discuss several other treatments that are less invasive and more affordable. Welcome back, doctor. How are you?
I'm doing well. Thank you again for having me.
So last time, in your last conversation that you had with Carly, I was able to learn that so many people do struggle with infertility, and it's one of those things that people don't like to talk about, though, and they don't know when to seek treatment. So what do you want people out there to know before we kind of just scratch the surface of this issue?
Yeah. I think one very important concept, it's not to delay to come and see the specialist. As I mentioned before, age is such an important aspect of what we do. And if you delay to see the specialist, then you are in fact decreasing your chances of being successful with what we have to offer to you in terms of care.
So don't hesitate. I think that's key. I'm glad we kind of brought that up right in the beginning, but so many times when people do think infertility, and I'm guilty of this, my mind goes straight to IVF. You say that there's so much more out there and many options that may fit families a little bit better, right?
Absolutely. Indeed, that's a great question, because the concept in our field is that IVF, it is the only thing that we have available, and it is expensive and it is invasive, and people are afraid of that. But in fact, the vast majority of our patients do not need IVF in order to conceive. In general, infertility treatment is divided in high complexity treatments, which includes IVF.
Okay.
But we also have low complexity treatments, more affordable, less invasive, and the majority of patients can conceive just with those treatments.
Well, you know, I've got to ask now what some of those treatments are to kind of give us an idea of some examples.
Right. So the one that is probably the most known out there is IUIs, or intrauterine inseminations, which are treatments that can also be done in conjunction with other aspects of the fertility care, like ovulation induction. So those are much less invasive, those are much more affordable, and they are very useful for patients with conditions like polycystic ovarian syndrome, patients for whom the husband has low sperm counts. Those patients do not need IVF. We can be very successful with these other treatments.
That's encouraging, because I think IVF definitely can be scary. The other way it can be scary as well is financially speaking. Are these other treatments, are they less expensive than IVF?
They are way less expensive.
Way less. We like way less.
Way less expensive. And in general, our approach is always to facilitate the access to care. Our philosophy is that no matter what the treatment that we need, we should be able to find a way that you can get access to care. But indeed, intrauterine inseminations, ovulation induction, these are simpler and way more affordable treatments.
I feel like you're kind of a myth buster right now, because I think people do have misconceptions when it does come to infertility. So you're kind of changing the way people look at it. You know, I'm curious, in someone in your position, I'm sure it never gets old when you do have success and you are able to help a family conceive.
I mean, it is, it's this amazing feeling. It's an amazing feeling to see a couple that have, the dream of parenthood, struggling, not being able to, and us coming in and helping them through, this journey, and to have, a positive pregnancy test at the end of this journey and see the smile on their faces, it's really, it's really priceless to us. So it's a great field to be in, to participate in people's lives, that way.
Well, and again, I know we talked about it at the beginning, but I think the key is don't wait if you do want to start a family. And if you have questions, of course, give Women's Care Florida a call. Any questions about infertility treatments, go ahead, get in touch with them today. And as you were saying, don't wait. There is hope out there. Thank you so much for joining us today. I really appreciate your time and all the information you've shared.
Thank you. I had a great time. Thank you.